Okay, so now we are going to look at the first question. After MI, which biological changes will be seen in the hypoxia? In hypoxia, there will decrease oxygen and there will be anaerobic glycolysis plus gluconeogenesis will be there in the MI. Like it is anaerobic myocardial infarction and hypoxemic necrosis of the cardiocytes. So next one is a patient after 1 year of gastrectomy develops anemia, fatigue, raised MCV which is 110, that is megaloblastic anemia, and neuropathy, numbness, tingling sensation. Which anemia is he suffering? Now MCV is 110, that is pernicious anemia because there is numbness and tingling. Three types of anemia is there. Let me clear that concept that what kind of three types of anemia are there. One is the microcytic in which MCV is less than 70 to 60. Another one is normocytic in which MCV between 80 to 100, and next one is macrocytic anemia that which MCV is more than 110. So that is macrocytic anemia. So in this condition we can call this megaloblastic anemia in which numbness because of vitamin B12 deficiency occurs. So we prescribe vitamin B12 to the patient and treat the patient according to the vitamin B12. Next one is a child is awake from the sleep status is walking termed as. Now sleep walking is termed as somnambulism. Sleep walking is termed as somnambulism. Now, okay, so as you can see in this picture, there is somnambulism in which a person wakes up, he is in the sleep and start walking. Now there is presentation like patient's attendant will tell you the complaints and treatment is often not detected, previous care, safeguard from window and doors, also regular sleep schedule, avoiding lack of sleep and alcohol. So this is the treatment of somnambulism. Next one is a woman had polyp in the cervix, removed histopathology portion shows polyp which is covered by the what kind of epithelium covers polyp. That is what kind of epithelium is changed. That is metaplastic changes in the polyp. Polyp. And next one is 29-year-old female present with a lethargy, irritability, lab shows HB is 9.6, MCV is 70, means microcytic anemia. MCHC is low, normal WBC platelet count, prescribed with the iron supplements with the 2-month hemoglobin stain, which is improved. Lab shows what kind of underlying anemia is there. Now there is HB electrophoresis is the test of choice which can be performed to diagnose the thalassemia in the patient. HB electrophoresis is the test of the choice. Next one is decreased potassium excretion due to metabolic acidosis. It decrease potassium excretion when excessive potassium is accumulated in the body. That condition is known as acidosis. Okay, next one is after diabetes, cytokines involved in the neutrophil migration are C5a. Chemotactic agent is strong. Chemotactic agent is C5. Now, when you can in this, you can see there's a margination, adhesion, rolling, transmigration. So this you have to correct this sequence. The question is correct the sequences, that is margination, rolling, adhesion, transmigration. So this is the correct sequence. The answer is B. Hormone responsible for glycolysis, gluconeogenesis, and ketogenesis means development of ketone bodies. The answer is glucagon. Glucagon is responsible for this one. Next one is in intrahepatic protein anabolism, extrahepatic catabolism, that is cortisol. 10-year-old boy was diagnosed with a tapeworm infestation. Which drug is treatment of the choice? That is niclosamide is treatment of the choice. Least dilated part of urethra or membranous part of the urethra which is least dilated. Next one is bone marrow biopsy is done from ventral iliac crest is the best portion side of bone marrow biopsy. First is posterior iliac crest, which is the first priority. Second is anterior superior iliac spine. Next one is the spinous process of the lumbar vertebrae, and the last one is tibia. Here you can easily tap the bone marrow, and these are very prime sites. Okay, so the next one is which hormone use phospholipase C as secondary messenger? That is oxytocin uses phospholipase C. You have to cram these type of the question. 45-year-old male patient with alcoholism history, severe epigastric pain, nausea, vomiting, fever, increased serum amylase level, which is indicative of pancreatitis. Now, superimposed on the chronic pancreatitis, which condition of the following type of the necrosis occurs in the pancreatitis? That is leaky factive necrosis occurs in the pancreatitis. That is fat necrosis. Sorry, fat necrosis is the answer of this because pancreatitis involved fat necrosis when there is brain necrosis is leaky factive necrosis. Okay, next one is type of the fluid occurs in the appendicitis is exudative fluid, which is protein concentration mold. Next one is a woman with a hypertrophied feature of the goiter, having diagnosed with iodine deficiency and large size of the thyroid gland cause of deficiency. There is uh, improper diet can result in the goiter development, enlargement of the thyroid gland. A patient having RTA, sustained sacral injury,